What up, respiratory family? This is our bowler or closed system suctioning device. This part right here goes to the endotracheal tube where the patient is mechanically ventilated. They're intubated. They have a endotracheal tube in their airway. This part goes to the connection which will go to the mechanical ventilation. These numbers you see here, if the patient has a endotracheal tube in, it may be a size 8, 7, or 6, or even half sizes. And these numbers, the patient may have a 8.0 tube and 22 at the lip. So these numbers show you how far you push this down to suction the patient. The patient goes into the patient. This goes into the patient's trachea. You push this button, and this activates the vacuum where you'll suction the patient and pull it out slowly. You want to make sure this black part is not in the window because it will prohibit some ventilation to the patient. So basically, we have this closed suction to prevent nosocomial infections, which is hospital-acquired infections. We want to have this as sterile as possible. This is going into the patient's airway, so we don't want to introduce any foreign bodies or substances into the patient's airway while we're suctioning them. And this is your Ballard closed system suctioning. This part right here is where the vacuum tubing is attached for suctioning. So when you suction the patient, you'll be able to suck out whatever's in their airway also. This part right here, usually we use for, some people frown upon it, but they do use this to instill normal saline into the patient's airway. Sometimes the patient's mucus becomes so viscous and so much large amount, and it's thick, that we have to sometimes introduce, normal saline into the patient's airway, loosen up a little bit so we can suction the patient out. Closed system bowler.